So here are the three things I often talk to my parents about whenever babies are going to get a vaccine. Things that I hope would just prevent a call to the pediatrician's office. So one is your baby might get a fever after a vaccine. Now this usually will last only 1 to 3 days and usually is not a very high fever. So if your baby has a fever that's going past 3 days, or they're having a really high fever, 104 and above, you probably should check in with your pediatrician to make sure nothing else is going on. Now, with any fever that they have within 1 to 3 days, that may be from the vaccine, you can give your baby some acetaminophen or Tylenol, if they are less than 6 months of age. And if they are 6 months of age and above, you can do some acetaminophen or Tylenol or ibuprofen, which will be things like Motrin or Advil. And those can help control the fever. Now, the second thing I mentioned is the area where your baby gets a vaccine might get swollen and tender, some redness around the area. That's usually just a local reaction, and that's not terribly uncommon. Again, you can use a cool compress for that just to help ease the discomfort. You can also give them some Tylenol or ibuprofen, depending on how old they are. If they are 6 months or above, you can introduce some ibuprofen or Motrin. If they are less than 6 months, usually you're only going to be sticking to acetaminophen or Tylenol. Now, the third thing I mentioned is the area where your baby gets a vaccine, as it heals, may form a knot. You may feel like a knot in the area. Now, typically that may be the thigh if they are babies, or if they're a little older, maybe in the arm. And that's usually just from blood, some bleeding into the muscle. And as the body heals that, part of what it does is deposit calcium into it. So it becomes a very hard knot. And then it starts to reabsorb all that calcium. And so at the end of the day, it does go away. But a few days after your baby's vaccine, you might notice a knot in the area, and that takes several weeks to clear. So it's usually not something to worry about. Now, if there's any symptoms your baby is experiencing that's really concerning to you, you should definitely reach out to your pediatrician. But these are usually fairly common reactions, and they're temporary and usually go away, and usually not a reason not to get your baby vaccinated, as you'll be preventing more important and more dangerous conditions that you're vaccinating against. So I hope this was helpful. Wherever you're watching this, there are going to be resources to help you understand your baby and know how to care for them confidently. This is Dr. Obidi, pediatrician at Partners in Pediatrics and Family Health and CEO of Newborn Prep Academy. Make sure you share this with a friend who has a newborn or is expecting one, because this will be definitely helpful to them as the baby starts to get vaccinated.